Time now for Morning Rounds, and joining us are CBS News chief medical correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, a major new study has drawn a clear link between testosterone supplements and heart attacks. John?
Anthony, these supplements are taken by millions of American men, but this study, the largest to date, raises serious questions.
An analysis by UCLA of insurance claims for more than 55,000 men looked at the rate of heart attacks within 90 days of starting testosterone. In men 65 and older, the risk more than doubled. In men younger than 65 with a history of heart disease, the risk almost tripled. Testosterone treatment is only FDA approved for conditions linked with so-called low T, documented low testosterone levels. But many men without low T are being treated for a variety of symptoms, such as fatigue and diminished libido. A study earlier this month found 43% of men receiving the hormone had a normal level. Cardiologist Dr. Steve Nissen of the Cleveland Clinic.
We don't know very much about this therapy. What's going on is a giant experiment with American men's health at stake because we don't have the long-term data on the safety of these products.
Annual prescriptions for testosterone more than doubled in just 4 years to 430 million, thanks in part to advertisements like this.
I have low testosterone. There, I said it.
Once it appears on television with seductive ads that make men think it's a fountain of youth, you're going to see a lot of off-label usage.
John, we've heard about these risks before, so what's new in this study?
Anthony, the arc here is so important. We heard as early as 2010 that small studies showed that there might be a possible cardiovascular risk. This is now the biggest study to date, and it shows that not only is there an increased risk in men who are over 65, but there's a new group, under 65-year-old men who have had a previous history of heart disease. Now, this is not the gold standard test. It doesn't show cause and effect, but thinking about how this use has exploded over the last few years, it's really a reason to be concerned.
But why? I mean, why do researchers think this is happening?
Well, there are lots of theories about it. One thing is that testosterone use might increase clotting of the blood vessels that supply the heart, and therefore they could cause a heart attack.
Also this week, another new study says the road to obesity starts before the age of 5. Research in the New England Journal of Medicine finds kids who are overweight in kindergarten are 4 times as likely to be obese in the 8th grade. That's startling.
It really is. You know, Vanita, this is such an impactful study because it's basically showing us that the die is cast so incredibly early in our lifetime for our obesity risk. You know, they looked at 7,000 kids and found that for the kids who were overweight in kindergarten, more than a third of them would go on to become obese by the 8th grade, and if you were obese in kindergarten, you had almost 100% chance of remaining obese in the 8th grade and beyond. So there really isn't such a thing as baby fat. It all matters.
All right, so how do you know then when your child is obese or overweight? Well,
really it starts about age 2. Your pediatrician can calculate what we call a body mass index, which looks at your height versus your weight. And if you're over 85th percentile, you're overweight, and if you're over the 95th percentile, you're obese. And these things really matter even as young as age 2.
We all know what the risk factors are and what happens in adults. Are they the same for kids who are growing up overweight?
You know, Vanita, they are just the same, only they're even more severe because kids are going to have these symptoms for longer. They're going to be more impactful in their lifetime. And now we're actually being able to predict that they might even have a shortened lifespan if they remain obese for their entire life.
All right, February is American Heart Month, so this morning we're bringing you our top 5 tips for a healthy heart for women. John, what are the basic things that a woman should leave the doctor's office knowing about this?
Well, there are certain numbers: blood pressure, blood sugar, and cholesterol. And the thing about these things is that they're silent. High blood pressure, silent. High blood sugar, you may not know. High cholesterol, you don't know. So you just actually have to know the number, ask the number. And a third of people in the United States have high blood pressure. A lot of them don't know it.
Holly, John mentioned silent, and I think of genetics, which is another perhaps silent risk factor. Are there other risk factors women should be aware of, though?
Right. Well, genetics is probably the most important. But I like to think of heart disease, our risk factors, sort of as a paper, rock, scissors game. There's genetics, there's diet, and there's exercise. Now, genetics might be the the most powerful, but you can overcome it with diet and exercise. Diet being loosely using that term because that also includes not smoking. But really it's about focusing on a plant-based diet, avoiding sodium, and exercise. Again, it doesn't have to be hours and hours at the gym, just even 30 minutes once a day will do it, or even just staying active. Get up, walk around, take the stairs if you can. All of those things can lower your risk.
John, what are the possible warning signs then for women of heart trouble?
Well, for women, there's a little bit of a misconception because they can have unusual signs, but still the most common symptom is chest pressure. But they can also have more unusual things like discomfort in their neck or their back, a little bit of shortness of breath, fatigue, nausea, even vomiting, a little bit of sweating. So these should not be things that should just be blown off. And I want to say also, it's not just women who can have these atypical symptoms, it's also men. Basically, if you're feeling rotten, if something's up, call your doctor.
Finally, this morning, most of us know that exercise can help people of all ages, including seniors. Carter Evans visited one gym where strength training is taking an unusual form.
1, 2.
This isn't your granddaughter's aerobics class.
3. Right there I go.
Call it a new twist.
Be careful.
On an old art form. Cane Fu.
We turned the fitness equation on its head.
Mike Marino is CEO of Nifty After 50, a fitness chain that developed the class with a simple goal.
To actually make a senior feel powerful with something that normally represents frailty.
Sometimes when they see you, they think, oh, poor thing.
Berta Mayberry is 77 and anything but frail.
I don't even walk like that, I walk like this. So they know it's a weapon.
The exercise itself is also a weapon, helping to prevent falls, which every year send more than 2 million seniors to the emergency room. According to the Centers for Disease Control, only 35% of Americans over 65 are considered physically fit. The aches and pains take their toll, says 81-year-old Julianne Gooslaw.
5 years ago, I broke my shoulder, and then I had a knee replacement a year ago.
But with regular visits to the gym,
Now I can do almost a mile on the treadmill, or I couldn't do that 2 years ago, but I can now.
I love this. It's like turning a symbol of what we might think of as weakness into one of strength.
I love the way she holds that cane.
Exactly.
This really strikes close to home for me because my 95-year-old dad fell a couple of months ago. He hurt himself. Fortunately, he's on the mend, but boy, he was knocked for a loop. Anything that can keep you up on your feet.
Yeah,
Now he can repurpose the cane if he has to have one.
That's true.
Dr. John LaPook, Dr. Holly Phillips, thank you both so much.
Great to be here.